accordingly. For tonight's agenda, we will have an overview of Friday, July 14th, Hill meetings best practices before and during your meeting, followed by legislative issues and updates on messaging, then a mock Hill visit followed by a Q&A session. So I'd like to first turn it over to Mary Ryan.
Great, thank you so much, Jason. I wanted to, next slide. Thank you. So our agenda for Friday is beginning at 7:15 a.m. is when you will depart for Capitol Hill. Everyone who is already in DC will meet in the lobby of the Washington Plaza Hotel. At 7:45 a.m. we will begin with a continental breakfast, a Hill visit briefing, the folder or packet pickup in the Rayburn House Office Building, rooms 2043 to 2045. It actually is just one big room that's all connected. At about 8:30 a.m. we will begin with remarks from several members of Congress who will be joining us. That will also be in the Rayburn House Office Building. From 9:30 until 1, that's the time for your Hill visits with congressional member offices. And of course, APhA staff will be available in room 122 of the Cannon House Office Building for luggage storage and to answer any other questions that you might need after 9:30 a.m. We'll also have maps of the Capitol Hill buildings as well as the House and Senate office buildings available to you at the Continental Breakfast, and remarks from the members of Congress in the Rayburn room. So you'll be able to start off knowing where you're going. So the second half of the day is the white coat photo on Capitol Hill. You'll meet at the Capitol Visitor Center, and that is labeled on the map that we'll provide. Lunch is on your own from 12 until 1:30. You'll also travel to the Washington Plaza Hotel during that time. Check-in for SLI2017 is from 1:30 to 2. Then beginning at 2 o'clock, we'll have the opening session with a keynote address from Congressman Paul Tonko of New York. At 5:15, we have dinner at APhA on the Potomac Terrace. Some of you have already purchased a souvenir APhA pack cup or pack cup and 2 drink tickets. So those of you that will have pre-purchased that, those will be available. And we'll also be selling pack cups for $5 and pack cups plus 2 drink tickets for $20. So those will be available at the door. Next slide, please. Okay, so very important on Friday morning, the Hill packet pickup. The packets are what we're using as a term for the folders that each of you will receive. Every person will have 1 folder per meeting, and they'll be arranged alphabetically by last name at that Rayburn room in that House Office Building in the morning for the breakfast and remarks from members of Congress. Next slide. Okay, what you all really want to hear about, Hill meeting best practices. To start with, preparations. Early start. I know some of you are traveling from the West Coast and it will feel extra early, but please be on time. The 7:15 a.m. departure from the hotel is very important because it's likely that you will need the full 30 minutes to get to the breakfast in the Rayburn House Office Building. Please wear business attire, and don't forget to bring business cards if you have them and your white coats for the photo. For those of you that are flying in Friday morning, if you have luggage, you can drop that off in the room I mentioned earlier, 122 of the Cannon House Office Building, anytime after 9:30 a.m. Anyone that's coming in late, that's also where you'll pick up your packet and or folder. And APhA staff will be there until about 3 p.m. or so to address any last-minute questions. But hopefully you won't need us there that late because you'll all be at the Washington Plaza Hotel already. Next slide. Okay, continuing with preparations. Research. Make sure you're familiar with all aspects of the issue, mainly provider status, prior to the meeting. it can help to prepare some of these items in advance. And we're going to review some of the provider status talking points later on in this webinar. But Wikipedia or Google can really be a great resource just for looking into what geographic area encompasses the House district whose member you're meeting with, the district demographics, and the congressperson or senator's biography and background, just to give you a little bit more information going into the meeting. As I said, we'll have talking points, and we'll also talk through some ways to anticipate some questions that they may have. Of course, check to see if the member or senator with whom you're meeting is a co-sponsor of our provider status legislation. And if more than one of you is attending the same meeting, be sure to practice who will play what role in each meeting. Next slide. Great. So at this point, expectations. You may meet with either the elected official, so either the actual congressperson or senator, or one of their staff members. Their staffers are absolutely experts in healthcare. They each have a designated healthcare staffer. So your meeting with staff should be treated as just as valuable as meeting with the legislators themselves. Please do not inject your political opinion into your message. This just isn't quite the right time for that. You're a representative of APhA for this meeting, not a representative of a particular political party. Each meeting should last about 15 to 20 minutes, and please set aside at least 20 minutes to walk between the buildings. There are 3 House office buildings, Cannon, Longworth, and Rayburn, and I believe 3 on the Senate side as well. And as I mentioned, we will have a map of the Capitol, so you know where you're going. Please do expect to go through security at each building. It's similar to the airport. And then during each meeting, do not assume that the person with whom you're meeting knows much about the practice of pharmacy. Some of them do, a lot of them don't. So using layman's terms can often help smooth the way to their understanding of what you're talking about. And also, please don't assume that they will remember you from a past visit if you've met with that member or staffer before. Next slide, please. Okay, conduct. So what to actually do in the meeting yourselves. Please try and arrive 3 to 5 minutes early. Know the name of the person with whom you're meeting. Of course, be polite in your tone and language. And as I mentioned earlier, party affiliation should not restrict anyone. Your legislators represent the entire district or state, and they meet with people of all political persuasions all the time. Remember to be enthusiastic and offer your assistance and enjoy the process. I mean, legislators and staff members want to and will listen to what you have to say about our provider status legislation, House Bill 592 and Senate Bill 109. And also listen and want to hear about your experience as a student pharmacist. Next slide. Additionally, please don't overstay your appointment. They really should last about 20 minutes at the most. Please do try and take a picture. Ask if the elected official would pose for a photo with you. APhA can use this in publicizing your advocacy on social media. And if you do get a photo, we absolutely want to see it. If you're on Facebook or Twitter or Instagram, you can likely tag the legislator in the photo, but of course, keep everything you share on social media from SLI, respectful and appropriate. Don't forget to leave the packets or the folders, same thing, with the office. The packets include state-specific material, so even if more than one of you has a packet to be left, you really only need to leave 1 or 2 of them. So there will be some extras is the point, but you only need to leave 1 or 2 of them with the office. And then, of course, follow up after a meeting, perhaps later on Friday or early the following week. Email a quick note to each person you met with, thank them for their time, and reemphasize the key points that you discussed during the meeting. Next slide. This is a sample of what some of the materials in each folder or packet will look like, just to familiarize yourselves with that. Many of them are state infographics and fact sheets that can be found on pharmacistprovidecare.com. Next slide. Great. So now the content of your meeting. To start with, be sure to identify yourself as a constituent and, of course, as a student pharmacist. You should state or reiterate what you want to discuss at the beginning of the meeting. So mainly asking them to support our provider status legislation or thanking them if they already do. Alicia Carey is going to review some other topics that may come up in a little while as well. Make your position clear and provide reasoning for it. One great way to do this is by relating a personal story or a patient story that drives home your message. The more you can make a connection with them, the bigger impact you'll have. Be attentive to their position and ask them what they think about yours. Remember the ask, clearly articulate our main message, asking them to co-sponsor our provider status legislation or thanking them if they already have. Also, they might ask you a question that you don't necessarily know the answer to right now. Totally okay, happens all the time. It's absolutely great and not a problem to say you don't know, but you can let them know that you will provide them with answers at a later date. And APhA staff can help you find the answers and assist you in follow-up. Next slide. Great, so now I'm going to turn it over to Alicia Carey for a review and updates on our legislative issues.
Great, thank you, Mary Ryan. Since we focused the first webinar on the issues, I will go through the provider status pretty quickly and then the other issues, and welcome any questions both tonight but also on Friday morning. So a refresher, provider status bills in the House is HR 592, and in the Senate Bill 109. The bills are identical in language. They had to be reintroduced from last year because this is a new session of Congress, so we're starting over fresh in January, trying to build up the co-sponsor list, of course, because that is a bellwether for how members, how important this legislation is. So we hit the 200 co-sponsor mark in the House earlier this week and 43 in the Senate. I'm hoping we get over the majority mark after you guys have all of your visits on Friday. That would be 218 in the House and 50 in the Senate, so that would be very exciting. So I challenge you to that. That would be a really neat thing for us to mark and follow up on your visit. So the bill simply allows pharmacists to bill Medicare Part B for the services that you provide. It would put pharmacists into the provider section in the Medicare Part B part of the Social Security Act. These services would only be allowed for people who live in medically underserved areas. Next slide, please. Some key considerations to think about when you're talking about the legislation is that the bill increases access and it improves outcomes by enabling pharmacists to treat patient care services that are consistent with your education and training. It's a very cost-effective way to increase access, and it's a consistent move toward value-based care and coordinated care throughout the healthcare system. Next slide, please. Tens of millions of Americans lack adequate access to primary health care. You all know that. This is some more information on the disease states. 27% of Americans have multiple chronic conditions, but 91% of Americans live within 5 miles of a pharmacy. So you are the most accessible healthcare provider that patients can access. So especially in medically underserved areas, play up that part of the legislation that you are very accessible, more accessible than other primary care physicians and providers. Next slide, please. It's unbelievable how many people don't know how what kind of schooling you go through. They think that it's like I heard somebody say the other day that it was, they wanted to know how long they could work behind the counter before they could be a licensed pharmacist. So the general public don't understand exactly what you do and all the extraneous education that you go through. So make sure you talk about that. Talk about where you are in school and what that entails, the clinical side of it, but also the patient-to-patient part of it. And that reiterate that you are the medication experts and that you have more medication education than any other healthcare provider. Next slide, please. The services that we usually highlight that you would be able to perform under this bill include blood pressure monitoring, immunization screening and administration, cholesterol testing, management of chronic conditions and related medications, so medication therapy management, point of care testing for influenza and strep throat, and transition of care services. So if you've had if you've been in the hospital setting and you can talk about some of the things you've done to help patients transition out of that, those are a really good way to show the value of pharmacists being in the system and being reimbursed for what you do. Next slide, please. All of this information is on pharmacistprovidecare.com, so I encourage you, if you have questions about it.
All right, thank you, Alicia Carey. So now we'll go ahead and thank you for that overview. We're going to go ahead and jump into a mock script that we have put together, myself and the Policy Standing Committee, Adrian Simmons, Daniel Gallipo, and Andy Stone. I'm just going to run through an example of kind of what Friday morning is going to look like, so we'll go ahead and take that away. Andy, so, hey, how may I help you?
We have a meeting today with Jason Gaines.
Okay, so do you have a business card?
Yes, here you go.
Okay, thank you. I have a seat, and he'll be right out with you shortly.
Thank you.
Andy and Dan, how's it going?
Good, that's us.
I'm Jason Gaines, the legislative correspondent handling health policy for Senator Gary Peters. Nice to meet you.
Nice to meet you as well.
Okay, you can follow me back here to our meeting room so we can speak further. Take a seat.
First, we want to thank you for taking the time to meet with us today. We're here on behalf of the American Pharmacists Association and our student pharmacists from Wayne State University and our constituents of Senator Gary Peters.
So you're from Detroit. How about those Lions?
Oh man, they're the best. This year they're going to make the Super Bowl for sure.
I don't know about that, but there's always hope. So how can I help you today?
I'm here to ask Senator Peters to support Senate Bill 109, the Pharmacy in Medically Underserved Areas Enhancement Act. Are you familiar with the bill?
Yes, but refresh my memory.
This bill has 3 essential points. It would provide access and coverage of pharmacist patient care services in medically underserved communities. These services would be covered under Medicare Part D, and pharmacist services would be under their state scope of practice. This is important everywhere in the U.S. and relevant in Michigan because 56 of our 83 counties include areas designated as medically underserved. This is a piece of legislation that the entire pharmacy profession supports. I know I just said a lot, but I'm interested to hear your thoughts.
So I can see how this bill would actually make a difference in the health of our communities, especially here in Michigan. Is there any opposition to the bill?
There's no opposition to the bill, including from the medical community. It's received bipartisan support.
Okay, excellent, excellent. So can you provide me with an example of these services?
Well, back in Michigan, Student pharmacists from all across the state volunteer in free clinics run entirely by student pharmacists, and it's so encouraging being able to help these patients improve their quality of life by managing their chronic diseases. Not only does it help them, but it decreases their need to go to the emergency room later on, saving on our overall healthcare costs. It's because of all these reasons that I would want to ask Senator Peters to co-sponsor Senate Bill 109.
Okay, so I can't say for sure, but I know the congressman has been considering co-sponsoring for a while now. These notes that I share with him may help him to come to a decision. So is there anything else you would like to discuss?
Yes, sir. There's one other piece of legislation. The Senate and the House are currently deliberating on drug importation of non-FDA approved prescription drugs. APhA supports efforts to increase patients' access to appropriate, safe, effective, and affordable prescription medications. And we believe that proposals to legalize importation of non-FDA approved drugs is in direct conflict with recent efforts by Congress and federal agencies to increase the integrity and security of the U.S. drug supply. Also, obtaining safe and effective medications is just one part of appropriate medication use. It also requires a health practitioner's knowledge of the patient's complete medication profile and an understanding by the patient of how to take the medication.
Okay, I understand. This does seem like a violation of safety and efficacy standards here in the U.S.
Yes, and at some point the congressman will have to vote on this legislation, and that's why we'd like to ask for him to support pharmacy's stance on both of these items.
I agree. So I'll speak with the senator and definitely follow up with you. So is there anything else I can do for you today?
That's everything we wanted to discuss today. We do have a folder here with some more information on these legislative items that we discussed, as well as some contact information for myself and for my other colleague here. We want to thank you so much for taking the time today to talk with us.
Of course, of course. It was a pleasure speaking with both of you.
We'll be following up about the congressman's co-sponsorship of Senate Bill 109. But before we go, would you mind if we get a business card and a picture with you?
Sure, as long as you guys keep praying for those Lions.
We sure will. Well, thank you again, sir. Have a nice day.
Excellent, excellent. So there's just a quick example of a sample Hill visit, and just to remember to touch on those main points. So looking at the issue at hand, providing those firsthand encounters, giving that experience that ties in Senate Bill 109, and then sticking to your message. So now at this time, we'll turn the webinar over for any questions and discussion.
So Jason, this is Keith. I'm not seeing any questions right now. Do you want to quickly have Alicia Carey address some of the additional topics that might arise during the Hill visits?
Yes, that is perfect. So we'll look at the
Can you hear me?
yes, we can.
Okay, great. Well, you may have heard Jason and Andy talking about drug importation. There are three topics that may come up in your meetings, and drug importation is definitely one that we have been following very closely. We have weighed in with Congress and with the administration to let them know that that drug importation is not the solution to the drug pricing problems that we're seeing. We are afraid that broadening importation laws would hinder efforts by state and local governments and private payers to focus on value as opposed to volume. So that's one issue that you can bring up if if the person you're meeting with thinks that drug importation is the panacea to this drug pricing issue. Another one is you can talk about how you're afraid that U.S. healthcare providers, including pharmacists, could be penalized if if people were able to get prescriptions from foreign sources. Some of the proposals that are out there in Congress would allow drug wholesalers to import drugs. So that would put the onus on pharmacists if they were to not get safe drugs that weren't FDA approved. We're also afraid that if patients started going across the border or U.S. Providers were not involved, that it would cause some uncoordinated care throughout the system. So that also goes away from the value-based coordinated care that the U.S. health system is trying to move toward. Obviously, studies show that patients certainly benefit when they have a relationship with their pharmacist. So you can talk about that more and talk about that you don't just dispense medication. It's a good opportunity to talk about the other things that you do for patients when you are filling their prescriptions. And then if you are familiar with track and trace, which is a new, which is a law that is being implemented that follows a drug from cradle to grave. We like to say basically from the time it leaves the manufacturer to the time it is dispensed to a patient is being implemented, and that would not be applicable if patients were able or others were able to go across the border and get drugs. So track and trace is a huge thing that would come into play with drug importation. If you'll go to the next slide, I'll cover a couple more topics if you don't mind. The opioids. This is a topic that I wouldn't bring up unless they do, but they may have questions for you. And so they may say, what are pharmacists doing? And you're probably far more aware of what pharmacists can do with the opioid and prescription drug abuse problems that are going across the country. But just know that APHA has been a strong supporter of the efforts that Congress the states are making to address the problem. As medication experts, we believe that pharmacists can play an important role in preventing drug abuse. Excuse me. Talk about how pharmacists are involved in pain management programs, and which include tapering services, and that y'all work in medication-assisted treatment programs, and that you are allowed to prescribe and dispense or prescribe naloxone in certain states. That's something that a lot of people don't realize when I mention it to them. So, and also you can bring up PDMPs if you're familiar with the way that prescription drug monitoring programs work. We believe that they are a great tool, but that they should be used at the pharmacist's discretion. So this is just one that if it comes up, be prepared. Healthcare reform, same thing. Please do not weigh in with your personal beliefs on healthcare reform. It is a very sticky wicket out there. We all have our own personal opinions. As a lobbyist, I'll tell you, sometimes it's hard to keep my opinions to myself, but I have to because we're representing APHA. So APHA does have a position, not a for or against position on healthcare reform, but we do have weighed in with Congress to let them know that some of the provisions in the repeal and replace proposals that we have seen out there would cut Medicaid. And so any cuts to Medicaid could further exacerbate barriers to coverage of prescription drugs for patients. Medicaid does not require prescription drug coverage. So we believe that cuts to this program could hurt access and care to medications. If they really want your opinion on healthcare reform, the best way to do it is to talk about provider status and tell them that if they want to know of a great way to cut costs in the healthcare system, it's by involving pharmacists into the system. So so that's what I always do, is I always try to bring it back down to provider status, that you guys really do help save the system money. So I ask you kindly not to interject your personal opinion and only bring this up if it is brought, if the staff or congressperson asks you about it. So.
All right, thank you, Alicia Carey, for that overview of additional topics. We hope that each of you were able to gain some more insight into the process and some concrete talking points for your visit. So just practice, remain composed, and things will go just well on Friday. For more information on APHA's provider status activities, you can visit pharmacistprovidecare.com. So now we'll open up the webinar for any last-minute questions.
Great, Jason, this is Keith. First question is from Sarah, and this probably is for Alicia Carey. Is there a good way to determine if a particular legislator serves a medically underserved area? Do you know if that's part of the infographics that we offer? I'm not quite sure if it goes down to that detail.
You're right. The infographics we have only are state-based. So we have the data, to be honest, but it's not easily accessible. It's given out by HHS. So if the person asks about their district in particular, we can certainly, winnow that out. But it usually is a compelling enough argument when you can talk about this state, because almost every congressional district has a medically underserved constituency. Even Washington, D.C., which is as urban as it is, has some medically served areas to it. So.
Great, thank you. Next question is from Shannon. If a student pharmacist hasn't been contacted yet regarding a legislative visit, being that this is Wednesday, what should we do at this point? And this might either be for you or for Grace as well.
I might let Grace take it first, and then because she's been really the front line on helping everyone set up meetings.
Hi, this is Grace speaking. So if you haven't received any information about visits, please go ahead and email me. We'll be releasing the final schedule of all the visits by early tomorrow morning, so you can take a quick look at that and double check your visit times and locations. And if we haven't been able to get you a visit at this point, most likely we will have you join another group and tag along. And that will be, and we'll play it by ear at that point.
And we just sent out Grace's email address through the chat function. Next question is from Ellie. Will we be in meetings with senators, representatives, staff members, their groups, or individually? So Alicia Carey, would you mind giving a quick overview of kind of what the office looks like? What you expect?
Absolutely, yeah. So on the House side, the offices are rather small. You'll probably be surprised at how small they are. Don't be surprised if you have to take a meeting in the hallway. I actually had a congressperson staff today tell me if they had more than 3 people in the meeting that they would have to go out to the hallway, because they're not just meeting with your group. There could be the agriculture LA could be meeting with, some farmers from the district or something like that. So the small office has to accommodate everything that's going on, not to mention all of the legislative work that they're doing on a day-to-day basis. So, however, sometimes you'll get to go into the member of Congress's office and meet with him or her in their office, and that's usually the case if you're meeting with the actual congressperson, but it's also sometimes the case if you're meeting with the staff. I'm sorry, I don't remember all of the question, but does that answer most of it, Keith?
Yeah, it definitely does. Most of the time you're going to be meeting with a member of their staff, not the actual representative or senator. And definitely everything that Alicia Carey said is still covered there. Next question
Can I say something
is,
really quick?
Yeah, absolutely.
Oh, I was just going to say, even if you have heard from your senator or your office that you are meeting with the senator or the congressperson, and you get there and they say, I'm so sorry, he or she had to go to the floor to vote or had a committee come up, don't show external disappointment. It's not uncalled for, and they always have very last minute things. So just roll with the punches and know that your meeting is just as important as what they're having to go do, but that they just had to walk away.
Great. Next question comes from Kelly. Kelly asks, if the senator or representative we are meeting with is already a co-sponsor, is it still appropriate to meet and discuss the legislation? So would you provide just a couple talking points, maybe in addition to the thank you, that you'd like for our students to talk about?
Sure thing. The way I usually begin meetings, if I'm ever meeting with someone that has already co-sponsored the legislation, is I start off by thanking them, like you said, and then I usually move on to say, we're hoping that the legislation moves through Congress this year. We have 200 co-sponsors on it already, but I just wanted to make sure you don't have any questions about it. And a lot of times they will, even though the congressperson already has signed on, they're still curious about what it is exactly pharmacist services are. Most of Hill staff are very young and invincible and haven't really had many health problems or have to use pharmacist services. If they go, they just get their medications filled. So talk about that a little bit, and then you can move on and say, are there any other issues pharmacy related that you would like to talk about? If they don't have any, then you can bring up the drug importation. In everyone's packet, in addition to the information about provider status, there is a letter that we recently sent to the Senate about drug importation. So it's a comprehensive review of APHA's stance on the issue, and it goes through some of the talking points that I mentioned earlier.
Great, thank you so much. Next question is from Catherine. Catherine asks, when talking about provider status, would it be appropriate to say that we offer preventative care as pharmacists to prevent expensive emergency room / hospital visits? Therefore, we are the step before patients get to a bad place? Is that how you kind of sell it on the Hill, or do you use other language when you're talking about pharmacist care?
Both. It's interesting, but I absolutely think that that's a talking point. I had a student pharmacist with me on the Hill a few months ago that she had an experience where they were doing a blood pressure screening in the pharmacy she had a rotation in, and they had someone that had very high blood pressure, and they were able to intervene at that moment and get her help, before something else bad happened. So you can talk about that. I also give the info. I always, for unfortunate reasons, I go to the worst case scenario, but I talk about how pharmacists can help manage diabetes or catch diabetes early, and that's a preventive measure, because you're going to save someone maybe from losing their eyesight or from losing a limb or a foot if they are able to get early preventive care. So like I said, those are drastic examples, but I think that they work because people, they don't go to the doctor every year or every month, but they do go to the pharmacy. And if they know that pharmacists can provide that care and are able to, then they can get those preventive services early on. I may punt that to you though, Keith, as a pharmacist. Do you have anything to add to that?
Yeah, I think that's appropriate, definitely, to talk about the role of the pharmacist as part of the healthcare team and how you are the medication expert, and having the education that you have definitely will help out that patient in any way possible. So cost savings is going to spring, them to listen a little bit further. So if you can tie those two together, that definitely works. All right, we have a next question here from Ellie again, and this is kind of for everybody here, but if we're flying in on Friday morning and unfortunately our flight is delayed or maybe even canceled, what's the protocol on Friday morning in order to contact the office?
I would suggest if you have students that are supposed to go on the meeting with you or are from your state, I would notify them and see if they could handle the meeting instead. If they are, I would notify the office immediately, the staff person that you have coordinated the meeting with, and to let them know that you unfortunately can't make it, but that some of your colleagues from your school or your state are going to be there instead. If you are going on the meeting solo, let me know and let the office know as soon as possible. I mean, worst case scenario, I grab somebody and he or she and I go and we take the meeting for you. So just, but let the office know and then let me know too.
Great. And I'll post Alicia Carey's email address up on the next screen here. I think that pretty much does it for our questions this evening. Oh, there's one other one in here from Kathy. Kathy asks, do we leave the packet with with the representative? And the answer is yes. We always want you to leave behind materials in the folder with the representative or the staff member that you're meeting with. However, I'd highly encourage you not to give them the folder the minute that you walk into the room. All too often, if you give that folder there, they then start reading through the materials, and unfortunately, they're not listening to what you're saying. So I'd highly encourage you to talk first, build a little bit of a rapport, and then use the infographic kind of as an example. If you have a story or if you've got some facts or information that you want to present, and then leave the rest of the folder with them at the end so that they're listening and talking to you as opposed to flipping through your materials, though. But we definitely want to put that information with that nice glossy APHA folder in their hands there. And then we have a follow-up question in regards to what do we do in regards to follow-up, Alicia Carey, whether it be questions directly from the member or questions from a staffer, or exactly what does APHA want to know after our visits here?
Thank you very much. We will have debriefing forms for you to pick up when you pick up the Hill packets that Mary Ryan mentioned earlier. So we'll have those for you in the room in Rayburn when you check in and come to breakfast on Friday morning. We'll also have them in the Cannon room, so you can fill them out. It's really important for us to know how your meeting went, good or bad, especially if you never know if the member that you're meeting with is on the committee of jurisdiction. They may have a really juicy tidbit that you need to share with us. So, and however we need to follow up with the office is really important. So I can't tell you enough how important that follow-up with us is. It's just a quick debriefing form. It will take you less than 5 minutes. If you pick it up when you check in the morning, and then all you have to do is just fill it out right when you walk out of the room, and just so it's fresh on your mind. But we would appreciate that feedback. It also helps us know who all, how many members everybody met with. That's a really good talking point for us, and highlighting all of the good work y'all have done. So thank you for that question, Keith.
All right, thank you all. So it looks like that was our final question. Here's everyone's contact information. If you have any questions prior to Friday, just shoot us an email. If it's in regard to scheduling, shoot Grace an email. We look forward to seeing you all here in DC. Have safe travels in and have a good night.